Just a few words to wrap up. First of all, thank you to all the speakers today. You did a great job. Each of these webinars has been terrific, but I think this was the best. I think we really nailed it this time. I'd like to thank the National Academies and the Forum on Preparedness and for Disasters and Emergencies for sponsoring this series. And I'm honored to have been asked to lead this effort. I think, I'm biased as well. I think it's been a very successful series, but it was only possible by the incredible hard work of the National Academy staff, particularly Aurelia, and also the really hard work of the planning committee over the course of the last several months. It's been a heavy lift, but I think we pulled it off. We started thinking about this series really back in the spring. Dan and I and others had conversations around the fact that the pandemic seemed to be winding down, case counts were way, way down, and we needed to capture the lessons learned about crisis standards of care while they were still fresh in our memory. Little did we realize that the Delta surge was just around the corner and that we were far from this pandemic being over. And today we're facing a new surge of cases. Almost every state is seeing rising cases, in some places implementing or at least authorizing crisis standards of care. And this is happening as we are entering the holiday season this week. And so, I fear this portends bad things ahead, at least for a period of time. So it's clear to me that there's a lot of work to be done on crisis standards of care. Some of our thinking has to be revised. Some of our guidance needs to be looked at again, and we need to do a much better job of reaching out to all the communities that Dan just talked about, to the provider communities, to government and policymakers, and to the general public. So my hope is that this webinar series is just the first step in making that happen, in revisiting crisis standards of care and thinking about what we need to do going forward. And so with that, I thank everybody on the webinar, the participants and the audience. I appreciate your time and your attention, and I wish you a safe, healthy, and happy Thanksgiving.